So now we've heard the personal story, and here's a man who is between the personal and the medical. Cory Kozlovich is at UCSD's CIRM Alpha Stem Cell Clinic. He's had his hand in just about anything. He's a science guy, he's a math guy, he's a tech guy, the clinical research data coordinator, which means he makes the numbers and the data make sense to the numbers crunchers, and most importantly, to patients like Roger, whom you just heard from. At UCSD, they're creating something that's really exciting because they're putting the information that explains to patients all about their diseases and treatments and therapies into the hands of patients via iPads. The potential is tremendous, and he'll tell us all about the progress.
Thank you for that wonderful introduction that summarizes everything pretty well, but let me just say, when I got into clinical research many years ago, my training told me two things, and at every medical center that I've been to since, the same two things. Number one, if you didn't write it down, it didn't happen, and number two, the informed consent process is truly an ongoing process. But we know that that can get better, and we know there are some hurdles that we encounter with the informed consent process and patients' understanding. So we at UC San Diego, along with our partners throughout the Alpha Stem Cell Clinic Network, have delved into an endeavor to make this a better experience for patients. So we're truly leading a global revolution of the enhanced consent process from a paper-based process to an iPad-based electronic enhanced experience. And as I mentioned, paper, which is the current paradigm, is indeed static, standard, and boring, to be brutally honest. We know that when we engage with patients for an informed consent, we have one or two discussions. We give them a ream of paper from 10 to 30 sheets long, and we hope they remember it. But the literature tells us that most patients forget about a third of it by the time they leave the office or come back for their first treatment. Conversely, enhanced electronic consent, which incorporates essential elements that you see rolling behind me now, can increase a patient's understanding about 40 to 60%, depending on how you measure it. So we decided, again, at UCSD, to go ahead and develop this experience for patients for this ongoing consent process by using essential elements in our enhanced consent on an iPad. So what is an essential element? Well, again, they're rolling behind me right now, but they're really basic things from using pagination and chapters to make things more digestible, to bolding keywords and having a table of contents with links throughout the book that empower the patient to have a self-guided learning experience. So if you want to know what the risks are, you can jump straight to the risk section. We can have the iPad talk to you. If you don't understand a word, it will speak it to you in your native language. And you can annotate the iPad as a patient. I'm going to talk about the annotations a bit later on. So those are the essential elements. And they're kind of part of the ingredients. So if those are the ingredients, we have then a recipe. And our recipe at UC San Diego is to use, if I can get the clicker going, the iPad Pro, which I have here for you. Not terribly large, comfortable to hold, big enough to show a video that you might want to show a patient. So it's a great device for that use. We then use freely available software, so it's free. So that means you can do this at your clinic if you wish, and I'll show you how later. We add essential elements to the verbatim text, right? We already have the paper, so we're just adding bold-faced words, colors, chapters, links, etc. And then we give some expert content also. Add those things together, boom, we've got e-consent, enhanced consent as we call it. Now, that's what we have right now at UC San Diego. However, there's always room to grow, reevaluate, and test, and we've done that as well. There we go. So data, what's the data? Well, we have we've quality tested this with our patients so far. We've used it on one patient on one clinical study, and this is because of the duration for us to initially set up the project, the iPad. I'll point out to you that this graph is reflecting the percentage of patients that decided that they would accept the iPad ultimately and use it. And you'll notice it adds up to 100% because 92% were for it immediately. One person was a little averse to begin with, but without any coaxing at all, decided to continue using it. So we haven't really had any pushback from our patients. So they're willing to use this. I will highlight, again, as I mentioned previously, a good load of patients as far as the usage patterns tend to navigate directly to the risks. So we know we need to focus on that in the future. And as I mentioned, the table of contents is critical. There's linking throughout the book, but to be able to jump to the section that tells you what you want to know, that's key. And then you see some feedback flying through along the way from some of our patients who are aged 41 to 83 years old. So this is an older population, and they have been using this iPad with minimal coaching, if any. Oops, can I go back? There we go. Okay, so again, I was alluding to ingredients and a recipe earlier. So now this would be the process that the recipe follows. So we begin with the content, and the content is exactly what you imagine it would be. It's the enhanced informed consent document, and it can include additional things. So at UC San Diego, we also include educational materials such as information about the disease, information about stem cells, because this is new to a lot of people, and information about clinical trials in general, to make sure that people have a full understanding of their options and opportunities at the self-guided learning experience. You'll see some numbers along the top of the screen here that explain different projects that we have going on with the iPad, and I'll explain those as all the slides advance. So then what's the next step? After we've created the content, anyone can create it. Me, you, a coordinator, anyone in an alpha clinic can write it up. But then we rely on physicians and scientists and even the patients to review that content, like in our quality review I just discussed. That way we know it's credible and reliable. After that, we form some partnerships. So we've partnered with Americans for Cures, Eureka Science, which is a group that creates whiteboard videos. It draws what happens when you take the drug or what happens when during your disease. So it's easier to understand. We also work with ISSCR, the largest stem cell organization in the world. They've provided us free content to be used offline, and that's key because we have a contained system that can be used regardless of if you have connectivity. You can take it home, you can take it outside, whatever you'd like to do. And an added perk for the IT people is that there's no risk to the enterprise network because you're not using the network. And finally, as I mentioned earlier, we're always redoing things. So we already had these great things in place, and then we decided that we could reforge wonderful partnerships. One example is that we provided all of the alpha clinics an iPad a couple months ago with a template so that they can start building their own. We reforged some partnerships with Americans for Cures and Eureka Science, and they have helped us to broker some deals to obtain more footage and more information for patients, which is great. Now, again, these numbers at the top describe the process. So we ended up receiving IRB approval in a period of 7 calendar days. So it was critical that we met with the IRB in advance to explain to them what this product is, and then it flew through. So, pro tip for you. Because this is an electronic document that can be shared between the patient and the provider, this genuinely is a learning together experience, and it involves a collection of your notes as a patient. And when we can look at your notes, we can offer real-time feedback to you. We as providers can address your questions. And we can do it in a way better than just paper. So with paper, maybe you circled something and you want to make sure that you get back to that with your coordinator, your nurse, your physician. With this enhanced consent, we can jump to a summary of every single thing you've highlighted or written and make sure that we cover every single one of those items along the way. So that's another way that this is radically different than paper. But that means we can do even more. So if we have a record of what you've written or highlighted or annotated, we can make this two-way feedback loop from patient to provider back to patient in the form of modifying the documents that we have wherever we see trends. So we have received an IRB approval 1 month ago for an, quote, annotation study that we're doing, and we can now collect those notes anonymously, take a look, and improve our consent documents and educational materials. So these are some key things for us as we continue growing. I will also add that we have an additional special helper beyond these partnerships we've already mentioned. In September 2015, we were fortunate enough to meet with Apple Incorporated up in Cupertino. And Apple has offered us 3 exciting services to make sure that our product is one that can be used very well. And perhaps the most exciting thing they've offered us is a quality review. So they have offered to go ahead and look at our program and make sure it meets Apple's standards as if they had created the application themselves. Now, again, everything that we've discussed up to now has been version 1.0, or what we're currently using in the clinic and offering at the other Alpha Clinic sites. We can envision a version 2.0, and you're seeing it on the screen. And the reason that we need, not want, a version 2.0 is because version 1 supplements the paper consent. It has everything as the paper consent, but unfortunately right now, patients still have to sign on paper because we don't have the ability to record an electronic signature or to record version control, which says, which version of the protocol did you sign? Is it an effective protocol? So with a couple of inputs, very few, we can leverage the resources of a coder or programmer or two, perhaps some of those services that Apple has provided for quality review, and leverage the resources of the Alpha Clinics networks by many means to hopefully come up with something that will do at least these 2 things. And once we have these 2 things in place, we are done with paper. There is no longer a need to have a paper record of the consent because it's there. So what does that mean? Version 2.5 or 3.0, we can envision that this product now, boom, goes straight to the medical record in Epic. Boom, you've got a PDF copy emailed to the patient. It's got everything you need that you're required to take home. Maybe put it on a USB drive. Maybe way farther down the road, this becomes a whole concierge sort of package that explains to patients, okay, I've arrived at the parking lot. I'm really nervous. What now? Well, here's how you get to the clinic. Make a left, go downstairs to the lab, come back up to the clinic, and you'll get a text message reminder in 2 weeks that you need to come back in 2 weeks after that. So we can really see this as becoming a fully integrated package for the entire experience. Hopefully you've noticed so far that these are really discrete parts that we're pulling together. Lots of sources, lots of inputs, lots of outputs, but they truly make up one project, and we all profit by that project. As I mentioned, the other Alpha Clinics do have these tablets and are using them. So how can you get involved? We would love you to be involved. We genuinely want your feedback. We would love you to create content for us. Whatever you want to do, call me, get involved, please. So how? Well, Alpha Clinics, ideally, you can create some content. You can translate your paper consent into at least a minimum enhanced consent like we use at UC San Diego. investigators, you can sit down with your study team and review the content they've created for medical accuracy, or you can sit down and write a book together. I've done it with one of our physicians, Dr. Choi, in fact, and we had a pretty good time. It only took about 45 minutes to an hour, so that's a great way to get involved. Patients and advocates, everything that we've done here is for you. This is not just for our benefit. We do benefit because of it, but if this does not succeed, then we have not met our goal. So we strongly encourage patients to report back to their coordinator, their doctor, call me, email me, find me, knock on my door. Let us know what's missing or what's a roadblock, because we really want this to work. So with that, I'd like to thank a lot of people who've made this possible, notably Dr. Jameson in our Alpha Clinic for spearheading this, my former colleague Jennifer Patterson at UCSD, who helped with a lot of the original content. We've had a lot of help from our friends at CIRM and some other groups I've already mentioned, and you know, a lot of guidance from the Stanford Stem Cell Clinical Center at UC San Diego Health. And with that, you have a beautiful sunset from the building I used to work in, but now I stare at the freeway. So thank you very much, everybody.